Prime Minister has defended the coronavirus vaccine rollout this morning, saying the government is prioritising safety over speed. More than 2 weeks after the first person was vaccinated in Australia, we are well behind those initial targets for administering doses. The government announced it was aiming to vaccinate 4 million people by the end of March, just a portion of the population, and by the end of October it pledged that every Australian who wanted the vaccine would get their dose. At least 60,000 people are supposed to be getting the jab each week. That's not happening.
This is not a race. We have no burning platform in Australia. We are taking it as quickly and carefully and safely as we can. We're not like the US or the UK or most other countries in the world where they've got people in hospital dying. We can take our time, set up our systems, do it safely and carefully. We are expanding our rollout every day.
Well, we do have a burning platform. The economic downsides to this are enormous with the slow vaccine rollout. Without a vaccine, domestic border closures are still a risk, and restrictions and lockdowns are just one quarantine leak away from being reinstated. How do we compare to the rest of the world? Well, globally, Israel is leading the race. 45% of its population have been vaccinated. Close to 4 million people have been given 2 doses already. The United States, around 9% of the population has been vaccinated. And in the United Kingdom, 23 million doses have been administered and 2% of the population is fully vaccinated. Let's go live to Canberra now. Our political reporter Andrea Crothers joins us. Andrea, it's not looking like Australia is going to meet any of its more short-term or long-term targets at this point.
Laura, it's certainly not a good look. The Prime Minister, as you said, has said that this is moving as fast and as safely as we possibly can. But just 2 weeks in and less than 3 to go before what was meant to be that March milestone of 4 million vaccinations, less than 3% of that target has been achieved. So what's the hold-up? Well, supply doesn't appear to be the issue. 1.3 million doses of the Pfizer and AstraZeneca vaccine are currently here in the country. Professor Brendan Murphy indicated that, as we know, some states had been a bit slower in terms of ramping up their program. But when the Prime Minister was asked exactly how many people will be expected to be vaccinated by the end of March, he couldn't say.
We said at the time that any of these estimates that we give are always subject, to the progress of the rollout and the events that we encounter along the way. And when we're in a better position to give an update on those figures, then we will. And we're certainly working to the sort of targets that we would hope for, but they're always subject to events. I think Australians know that they want the vaccination program rolled out safely and surely.
Now, Professor Brendan Murphy insisted that the major target was always to have every adult in Australia vaccinated by the end of October. They indicate that that could still be on track, estimating up to 1 million people could be vaccinated every week as the program ramps up. And the AstraZeneca vaccine, it started being delivered this week. It's the vaccine which most Australians will receive. Professor Brendan Murphy heralded it as a workhorse, which no doubt the government will be hoping drags this slow coach back on track.
Yeah, it's still a little while away. Brendan Murphy also saying their challenge is getting this vaccine into bottles at the moment. I would have thought that we could have got some advice on that before time. But anyway, Andrea, I digress. The Prime Minister also addressed concerns about Greg Hunt's hospitalisation just days after receiving his vaccine. What did he have to say?
Yeah, it was some pretty extraordinary news, wasn't it? The Health Minister going into hospital last night, just 2 days after receiving the AstraZeneca jab. You can imagine it be weighing very heavily on their minds that this could strike fear in the minds of others, that the vaccine may not be safe. But the Prime Minister insisted today that the two are not related.
Yes, I am certain of that. I'm on the medical advice that I've been provided. Minister Hunter and probably Professor Murphy is better equipped to give you an update on his medical situation, but he'll be fine by next week. He'll be back up on his feet.
Now, they are hoping for a speedy recovery, but of course he is the third Cabinet Minister to go on leave. Laura?